Firstly, thank you for joining the conference. For those of you who weren't part of the session earlier today or I haven't met before, my name's Ross Joanidis. I'm one of the strategic leads at Active Sussex. I'm going to be facilitating this session, which will be looking at long-term health conditions and how this impacts people's ability to be active and challenging the status quo and how we improve the experience. We're really lucky to have two really good guest speakers for this session. So we've got Tom Burton, who is the National Partnerships Lead for Health and Inactivity at Sport England, and Jane Knowles, who's the Chief Executive Officer for Somerset Activity and Sports Partnership, which is the equivalent of Active Sussex down in Somerset. Both had agreed to do this session in person back at a time when we thought it was possible. So we really do appreciate them agreeing to deliver this virtually and their commitment to the conference. Both are going to present for around 30 to 35 minutes, and then there'll be about 20 minutes for a Q&A at the end of the session. So if you have any questions, can you pop them into the chat with your name and where you're from as we go along, and I'll try to ask as many as possible to Tom and Jane at the end. Any we don't get through, I'm sure there'll be an opportunity for us to get some responses from Tom and Jane once the session is done. So I'm not going to take up any more time and pass you straight over to Tom Burton from Sport England.
Cool, thanks very much, Ross, and hi everyone. I'm just going to try and share my screen, so I'm hoping this is going to work for everyone. Let's see. Ross, can you just confirm you can see that for me?
I can see that, Tom. Yeah, that's great.
Perfect. That's a good start, isn't it? So, yeah, no, thanks very much for having me, everyone. Today we're going to be, and I really appreciate coming to talking to you. I know there's a real wide range of organisations and partners on the line today. A bit of a double act. So I'm going to talk us through some of the context as to why this is an important audience, what some of the data is telling us. I think it'd be naive not to touch on COVID and the impact it's had on this audience, some of the national work that is underway or is in the pipeline, and then we'll talk a bit about the We're Undefeatable campaign just to bring it to life a little bit, and then that will segue nicely into Jane, who I'll let introduce herself when we get to that point. So a bit of a tag team between Jane and I. So as Ross said, so I work at Sport England, our health and inactivity team. I'm one of our national partnership leads. And what that really means is I look after and responsible for a number of our investments around tackling inactivity and particularly to improve health outcomes. So we as a team, probably uniquely placed at Sport England to lead some of those relationships with some of the leading health bodies. So we have a dialogue with the Department for Health and Social Care, NHS England, Public Health England, albeit we know there's some challenges there at the moment. And a number of other medical bodies as well, just to try and bridge this gap between the sport and physical activity sector and the health sector, which we know is happening really well already and across a number of our places across the country. So we're going to talk a bit about how do we support and inspire people living with health conditions to be active, how we've been doing that for a number of years and perhaps challenging some of our thinking around that. And ultimately we want to improve the experience of people living with health conditions to become active. I thought a really good and interesting place to start is just, and before we move on to some of the bulk of the presentation, is that 1 in 4 people in the UK live with at least one long-term health condition. So 4 in 10. So, and this is growing. Year on year, this is growing. So no longer is this an audience that are considered a niche. This is actually becoming the norm. I think all of us will be able to recognise and identify friends and families, or even ourselves, that might live with long-term health conditions. We appreciate individuals don't necessarily present in that way, but so for the purposes of this presentation and the work we do as a sector, there is some real clear nuance around what some of those support needs might be. And we know that being active helps manage over 20 chronic health conditions. It either prevents, reduces the risk by up to 40%. A number of health conditions. It can delay the onset of health conditions. It can reduce the severity, and it can certainly help manage and treat people living with long-term health conditions as well, particularly around mental health. So we know that's one of the sort of the key evidence base, if you like, around supporting this particular audience. So I thought it'd be a good place to start is understanding some of the challenges that exist around how supporting this particular audience, and some of the challenges that they as individuals face, and the impact that COVID has brought. And a good place to start there is the Active Lives survey. So many of you will be familiar with Active Lives survey. This is our sort of main national surveillance program to understand and activity details are released twice a year in May and October. So we are waiting for a new tranche of data next month. So this data set does not take into account any impact that COVID has, but I thought it'd be a really good place to start, really, in terms of starting to paint the picture. So what you've got along the top there is for those individuals that respond to the survey that live with a life-limiting disability or long-term health condition, and then along the bottom are those that have self-reported themselves not to have a disability or health condition. And what this effectively shows, there's a few reasons I thought it'd be useful to bring this slide up, is that as you can see down the left-hand side there, the proportion of those people that say they're inactive, you're almost twice as likely to be inactive if you live with a disability or long-term health condition. So there's no doubt this is an audience that's disproportionately affected by the barriers around becoming active. But really importantly is the proportion that are active. So whilst it's not to the level of the general population or for those not living with a health condition or disability, over 47% of people with a health condition or disability achieve those recommended Chief Medical Officer guidelines of 150 minutes moderate intensity a week. I think that's really important because often, and as we'll come on to through this presentation, it's very easy when we talk about audiences to see them all as one homogenous group. And actually, you know, for almost half of this population, they are finding ways to be active that works for them. Physical activity is an important part of their life, and they tend to have a more resilient habit. But it's also important to remember that these are behaviours. So whilst having a long-term health condition is part of being an audience, we know that people can very easily transition in and out of these things. But I thought it was a good place to start, high levels of inactivity, but still a big proportion of this audience that achieve the recommended guidelines. So something's working for them. Digging a bit deeper then, we know that the more impairments you tend to have, the greater the challenges, perceived or actual, it is to become active. So you can see on the right-hand side there, you know, where you live with 3 or more recognised impairments, you're actually, you know, much more likely to be inactive or less likely to achieve the recommended guidelines. But really, in a really heartening way, what we've seen over the last couple of Active Lives survey data sets is that for those people living with the most impairments, we're starting to see a statistically significant rise in those that are achieving the CMO guidelines. So we need to start to unpick why that is, but it is a really, really positive sign and a trend that we definitely want to continue. Coming on to COVID, many of you may be familiar that, and I've seen the data published through different Sport England channels and on our website, and I don't want this to be death by graphs here, but at the same time, this is a really important picture to show, is that what this graph tells us is that throughout, we commissioned some weekly research right throughout the pandemic, on the left-hand side, right from early April to the right-hand side in mid-September. These are the proportions of people that say there's a long-standing condition or illness there and how active they are. Now, the red line, the red dots, this is the proportion of people at each time point, each week, that say that they've done no activity throughout, you know, over the last week when they've been asked this question. And this is over a sample of about 2,000 that are sampled each week throughout this. So we can see, you know, broadly speaking, it's remained sort of stable, sort of 26 up to the late 20s. You know, we're seeing actually people still struggling to be active at all throughout the pandemic. And if actually what this doesn't tell us is some of the stark inequalities. So within this audience, if you are part of a lower socioeconomic group, or for some BAME communities, you're even more likely to have been to become inactive or much less active during the pandemic. But I think really the part of this graph that for me is the real worry is the green line. So this is those individuals that have said at each time point that they've done at least 30 minutes on 5 days across the week. So this is the cohort that have quite a resilient habit of being active. And what you can see on the left-hand side, almost 30%, 29% were doing 30 minutes a day on at least 5 days a week, and right throughout the pandemic. And whilst it raised up in the middle, it started to come down now. And this is quite worrying. So this is a sign that people are finding it, even with a resilient habit, are finding it more challenging to become active. And I'll pick up on this a bit more in the We're Undefeatable slides a bit later on. But as part of the campaign, we've got a qualitative research group, a focus group. It's a wide range of individuals with lived experience, range of long-term conditions, range of severities of those particular conditions, who we sense check all of the work we do with, just to make sure that it does resonate, and we use those individuals as a real sounding board for what we do. What we're hearing from that group and through some of the surveys is that there's a real starkness around the impact on this audience. There's heightened, and some of this won't be a surprise to you, and actually a lot of this is familiar to people who don't live with a health condition. But this is for this audience, it's been exacerbated by COVID. So heightened anxiety that saps motivation, a real roller coaster of feelings, real fear surrounding lockdown easing and what that might mean, and a real confusion around government guidelines, a need for reassurance around the safety of activity and the suitability, a wariness of reopening of activities and facilities, and a lack of trust in the guidelines, and a lack of trust in other people to behave in the right way. And so we often think, actually, we need to get the right information and really provide lots of information to this audience to reassure. And what we're also seeing at the bottom there is an audience that's overwhelmed by information, and they're struggling to filter and process it all. And by doing that, it's an additional barrier to becoming active. So it's a really, really challenging situation, and to get that balance right. Building on that further, we know on the left-hand side there, and that sort of the purple lilac and the sort of the grey coloured graph on the left-hand side there, we know that 4 in 10 people say they're doing less physical activity. So 4 in 10 with a health condition doing less physical activity since the outbreak. So whilst there's a proportion that are doing more and some that are doing the same, the greatest proportion doing less. And that's a real concern for us, and something we really need to want to continue to consider and address, and to get the messaging and the support and inspiration right to this audience. And 45% say that they worry about leaving the house for exercise at all. And I think with the latest announcements from Boris and coming out of government, all of this uncertainty is an additional barrier to becoming active, and a sense that whilst the rates are rising, this is actually something that's really affecting this particular audience. So I guess moving on from what the data is telling us, and some of the research that's come out during COVID and what we're hearing, and I'm sure a lot of that won't be a surprise to many of you, is to move on to what some of the common perceptions and ingrained thoughts are that we hear a lot about this particular audience. And this is the extreme end of the spectrum. So this is not what we hear from everyone, but this is what we hear quite a lot, and I'm sure many of you have heard this as well, around how we think and support people with long-term health conditions. The rest is always best. And whilst rest is absolutely a critical part of the management of long-term conditions, it should not be the only message that's given. So we know actually, whilst it might feel counterintuitive to many who suffer from chronic fatigue and struggle with pain management with various long-term conditions, actually there's so much evidence around becoming active as a means to address that and to help treat and manage that. So getting that message, making sure the evidence is clear and getting those messages right is absolutely imperative. We hear that people living with a health condition should only be signposted into condition-specific exercise, or only into activity that's for people with health conditions. And of course, we're forgetting that's not necessarily what's right for that individual. So how do we continue to place the individual at the heart of it? We hear that all people seek condition-specific advice before getting active. Many people understand their conditions better than anyone else and understand what those symptoms are and how best to manage it. So don't all need to seek that advice, but it is important that advice is there when required. All people this is all one homogenous group, and then we touched on that. And actually there's an expectation that any coach or instructors or provider of activity has to have a real in-depth knowledge of long-term conditions and be a specialist. And of course, that's completely unrealistic. But there is something, as we'll come on to later on, around where can you go for more information, should you need to be able to provide a really positive experience for someone. So I don't want to go into this too much, but this is a diagram from the NHS long-term plan. This is their comprehensive model of personalised care. This is around ultimately how do you empower individuals to take control and manage their health in the best possible way. So they're not necessarily just directed by clinicians. There's part of a co-production with the patient. And I think the reason why I've put this slide on here, because I think it's important, we often see, and again, we view everyone and the sector is guilty of this, and I've been guilty of this as well, is we view everyone with a long-term condition as being high risk, as having complex needs. And actually what we know is that only 5% of the population from NHS definitions are considered to require very specialist support and have very complex needs. That actually 30%, that middle part of the triangle, 30% of people live with a long-term health condition. And whilst they need some targeted support, that is about reaching them, giving them the right messages and identifying the right type of support for them. Actually, this is around empowering the individual to be able to make the decisions for themselves, and therefore choice and opportunity and motivation is key to be able to achieving that. But it's recognizing this is a sliding scale. So depending on where people are, they might ebb and flow out of complex needs into the bottom, whole population cohort as well. So I just want to go on to touch on some of the programs that are underway, and this is a bit of a snapshot, and apologies, there's quite a few things here, but I think it's important that and we'll share these slides afterwards so you'll be able to look through them in your own time, but to start to touch on what some of these programs and policies are. And in order to do that, to take a whole system approach, we need to really consider changing some of the social, cultural and organizational norms that we see and hear quite a lot. On the left-hand side there's obviously changing the motivations and attitudes of individuals with their health conditions, making sure that there's a real value placed on being active, recognizing what movement and activity could mean for them, and understanding where those opportunities are. We need to get the messages right around the network, around the individual, whether that be the healthcare professional, the carer, or the friends and family. So those messages are consistent and they're evidence-based, so they don't contradict each other. And we need to make sure that the opportunities, in whatever way that individual chooses to get active, that they have a great experience of it. So they're not pigeonholed down a particular referral or signposting route, but they're supported in a way that works for them and in the best interest of them and their symptoms and or condition. So this really complicated diagram, I won't go into huge, but what this shows is twofold really. Along the top row there, the purpley lilac-y colour, we've got a range of ways that, this is all around activating system change, but there's a range of ways we want to inspire and motivate and support the individual. And that is the COM-B there, as many of you will be familiar with, that's in supporting an individual's capability, opportunity and feelings of motivation, which leads to a change in behaviour. So it's one of the core sort of behaviour change theory that underpins all of this, as well as the Sport England, the trans theoretical model that Sport England advocates through their strategy. So we'll touch on this in the next few slides, but effectively what it shows is, we want individuals to feel inspired by the campaign and what they see and hear, supported through different charity interaction they might have, that they get really key and consistent and evidence-based messages by healthcare professionals, if they're engaged in social prescribing, or whether they go and access local community provision. But there's actually a raft of programs and work underway to underpin all of that. Now, this isn't everything going on. There's loads going on at a local level. It's underpinned by relationships and cultures, locally. But this starts to paint a bit of a picture of some of the work we're doing, which I'll go on to touch on. So some of the work we're doing with healthcare professionals is really driven through our Moving Healthcare Professionals programme, which is in partnership with Public Health England. And we recognise actually Public Health England have quite a trusted voice amongst this particular audience, as do some of our other partners. So we're not always best placed to deliver the messages, but we can support in creating some of the content and distributing it and connecting things up. So the clinical champion training is one of the key strands of the Moving Healthcare Professional programme, which is all about training existing clinicians across a range of disciplines, whether that be GPs, nurses, physios, midwives, pharmacists, to actually be trained up as physical activity champions who then deliver training to their peers. And where we've evaluated this programme so far, it's had a really positive impact on other clinicians' views of physical activity and their confidence to be able to talk about it. And that's underpinned by a couple of other areas of work. The Moving Medicine platform. If you've not been on the Moving Medicine platform, it's a website. I'd really encourage you to Google it. It is a clinician-facing resource, but anyone can go on there and understand a bit more around some of the health conditions that exist. And the purpose of Moving Medicine is very much to enable clinicians to be able to have conversations in the right way with their patients, depending on the different periods of time that they might have, because we know time is one of the critical factors that sometimes limits discussions around physical activity. And there's also lots of e-learning modules that are CPD point accredited for healthcare professionals if they want to learn more about this space. So it's almost a package, if you like, that we really try and push or encourage, I should say, healthcare professionals to access, and it forms part of their sort of professional development. And we've also got developing really strong relationship with the Royal College of GPs, who amazingly have prioritised physical activity as one of their focus areas over the next few years. So they've developed a whole physical activity toolkit on their website, and these are all things you can go on and access. And one of the key tools, if you like, that they want to support this sector with is encouraging all GP practices to become an active practice, to sign up to the Active Practice Charter. And that is effectively driving all staff and patients to lead a more active lifestyle and be less sedentary. But how do you take a whole practice approach to that? And I know Jane might touch a bit more on that a bit later on.
Oh, there it is.
And one of the areas and underpinning areas of the systemic barriers to supporting this audience is a real fear around liability, indemnity, and risk. And it dominates how we view this audience as a sector, and it has done for many years. So because we consider this audience to be high risk, we need to have very high mitigation for that. And actually, it's a sector that we recognise collectively across a range of organisations that it isn't necessarily driven by what the individual's needs are, they're driven by what the issues are around risk. So in order to start to mitigate that, and we understand that there is fears around individuals having an adverse effect or adverse event on them and exacerbated symptoms as a result of becoming active, and could that lead back to me as either as a healthcare professional or as a coach or whatever it might be. And this is something that's been around for a number of years, and it's something we really need to face head on. So one of the ways we're starting to do that is through a partnership with the Royal College and the Faculty of Sport and Exercise Medicine. We are looking to develop a consensus statement on risk. And what this really is looking at all of the evidence, a systematic review of all of the literature and the evidence that's out there about being active with a long-term health condition, and actually what it means and what are those risks in reality, and what do we know about the risks of being active. And whilst, of course, there are examples of adverse events and effects, actually overwhelmingly, you are significantly more likely to damage your health or for your condition to worsen if you remain inactive than if you take some steps into becoming active. The key to it is taking those steps in a way that works for you in that condition, into light to moderate intensity, not jumping into something, high intensity. But of course, for some individuals, they might feel they're able to do that. So actually, this having all of the evidence and these consensus statements backed up by some of the key medical bodies will be a really good underpinning factor in starting to challenge how we view risk and this particular audience. And why is this risk statement so important? Well, it will provide healthcare professionals with the confidence that it's safe to encourage patients to be active. And really interestingly, even though there's a real growing momentum around clinicians talking about physical activity, some of the research that we've undertaken shows that there is still a significant number that feel unable or feel unsure about referring or signposting a patient for fear of what those adverse effects might be, because they don't feel they necessarily understand the condition well enough. And therefore, this is something that might start to mitigate that. It will provide information to patients regarding the concerns about their symptoms, so patient-facing resources to reassure. We know that we want to talk to the Department for Health and Social Care and other medico-legal bodies about this, because we know in some parts of the sector, individuals are pushed back to their GP to get approval. And actually they've taken huge steps to go to a session, they're pushed back, which is a big barrier in itself. And in some cases are being charged for a letter of approval from their GP. And this is something they're not doing anything wrong, GPs and practices, to do that. It's something they're able to do under their rules with the British Medical Association. And that's something we think we want to challenge as part of some of the policy. We don't want anyone to be charged for an approval to exercise form, if you like. We want to provide the basis of conversations with the insurance sector that underpins all of our insurances to lead sessions and to run clubs and to, as national governing bodies or leisure operators, whatever it might be, around the risk management and the triage of individuals. And we know this is something we really need to get on top of. And of course, this is going to impact heavily on the workforce. Oh, that was a different slide, how it appeared. So I guess coming on to workforce, we are doing some work with UK Coaching, who you might be familiar with. They're one of our strategic partners at Sport England to lead, as well as SIMSPA and the Activity Alliance, around so how do we ensure that we provide the confidence the workforce to provide a great experience to this audience of being active. And we're building on what's strong, not what's wrong. So we know there's some brilliant examples across up and down the country of someone turns up and they tick a box on the registration form and they've got a health condition. You know, they have a great experience of being active. But we also know from some of the surveys that have come out of Simsbury and UK Coaching, there's a real nervousness around supporting this audience. And therefore we want to do some work to reassure. And we want to really build a learning and development pathway that ultimately at its core is around great customer service. It's around having a positive person-centered approach, how you treat anyone that turns up to your session. But we know there's lots we're learning around long-term conditions specifically that will be really useful for coaches to understand, whether it be around the motivations of this audience, or whether, you know, if someone turns up with diabetes or has a heart condition, we never expect the coach to be a specialist. But actually, is there some way you can go, perhaps linked to the charities, for instance, where you can go for more information to help you as a coach provide that great experience to that individual? Now, UK Coaching are the expert body, and this whole pathway will be co-produced with a range of organisations. This isn't something that will just be developed in the ivory towers and then dropped down locally. We really want to get people's thoughts and feed into this as to how it might look and work in practice. So it's a real valuable tool and resource. And of course, all the work around risk will very much align and feed into this. And the final thing before I talk about We Are Undefeatable, and I guess where it starts to segue into Jane's presentation, is there's lots there. It's complex and it's messy and it can feel a bit disparate if we're not careful. And so we need a way to pull it all together, and so that everyone's working off the same set of guidelines or the same framework, whether you're a club or a coach, or if you're a policy maker or commissioner. Wherever your level, we want people to be thinking actually and working from the same hymn sheet. And so our easier to be active work is the starting point to do that. It's the outcome, if you like, of this work is to create a framework that all of us understand and understand where our roles and responsibilities are as different types of organisations, and what the individual, built around the individual, what their needs are and how we can support that collectively and as a whole system. So I won't go into too much detail because we're in the early stages of this, but all of those things I've talked about will feed into this easier to be active framework. But the purpose of it is to create a frictionless experience of becoming active for people with a long-term health condition. This work has been led by the National Centre for Sport and Exercise Medicine at Sheffield Hallam University. It's a real experts in this space, but it's being underpinned by Sport England and lottery funding and through Public Health England as well. And so some of the bullet points on the right-hand side from phase one of some engagement, which is through 1,500 organisations or so fed into this process. And there's some of the key themes, if you like, that need to be considered as part of that framework. So we haven't got time to go into them now. But for those of you that attend the We're Undefeatable webinars, we tend to go into a bit more detail around some of these points. So that's something, I guess, if you want to know more, you can learn about through those supporter webinars. So this brings us onto the We're Undefeatable campaign. So one of the tools, if you like, as part of our drive to support this audience is, okay, how can we really actually reach and engage the audience? And that's where the We're Undefeatable campaign came from. As you can see, there's a number of national charities that underpin the campaign. They drive the campaign. They are the trusted voice and the trusted brand to this particular audience, not Sport England. And we recognise this is the first time internationally that a group of charities have come together to get behind something, a focus area like physical activity, and get behind a campaign like this. So it's a really exciting campaign. And at its core, We Are Undefeatable is all around inspiring individuals to driving up demand to want to be active. And I'll talk through a couple of the ways that we start to do that. So activating the campaign and bring it to life is still something all of us can get involved with. But it provides a brand to sort of galvanise and stimulate conversations around what more can we do to support this audience to get active. If they're a bit more inspired through the campaign, brilliant. But there's lots of work behind the scenes that we need to do. So what I want to share with you, and I'm hoping this will play, this is one of our case study stories, Tommy, who has agreed to, who lives with a health condition. I'll let Tommy explain it through the video. And we have a range of case study stories that we can share that are on the website that ultimately, I think, it really brings to life what the campaign is all about. Oh, apologies. Let me just bring this back to, if you can see that. So I guess Tommy's a number of stories that really brings to life what We're Undefeatable is all about. It's about finding ways to be active that work for you. It isn't always about, we know the benefits of group-based activity, we know the benefits, and some individuals will really benefit from more specialist support. But ultimately, we know the people that are much more likely to lead an active lifestyle are those that can find a number of different ways they can weave it into their daily and weekly routines, particularly during COVID, where that is perhaps a bit more challenging. So I think really, in a really heartening sense, we know that through all of the evaluation of the campaign, we know it's really reaching and resonating with this audience more now than it probably has before COVID. And it feels like the tone is right, the messages feel right, it's about real people. And so there's a real good opportunity, I guess, to amplify this further and use it as a really strong tool to support this audience during this period of time and beyond. I talked about some of the charities that we work closely with. So whilst they are the brand, if you like, the drivers behind the campaign, they're also, all of them, looking to embed physical activity into their core business. So physical activity has played a differing level of priority for each of the charities, but actually this, and going forwards now, we're starting to see it really being a golden thread throughout what the charities do. This is just a selection of some of those in terms of how they support their respective audiences. And I guess over the last 6 months or so, and apologies, I'm unashamedly using some of the slides we used at the last We're Undefeatable webinar, but we've updated the website. If you've not been on the We're Undefeatable website, I would encourage you to do so, we'reundefeatable.co.uk. You can also access the supporters hub on there, and there's a wide range of assets and tools and resources, whether that be around helping you to talk to the audience, or whether they're things you can use in your social media, or ways and examples of what others have done to activate the campaign. There's lots in there to give you some inspiration and ideas. We've developed new TV and radio ads and the case study stories. I've just shared one of those, Tommy, with you. For those that are more digitally excluded, and we know this has been a particular challenge during COVID, and there's been a wide range across the country of approaches to support this. We developed the We're Undefeatable leaflet, which has got a pull out there for different types of exercises. There's the 5 in 5 offer, which is on the website, which is a range of activities that individuals can do for 1 minute each, and you can pick 5 of those a day. And hopefully the idea is it stimulates a bit of confidence as to doing more. For those of you that are fans of Sunday Brunch, we developed a bit of a corporate relationship with, it's not something I was involved with, but really good to see We're Undefeatable appear on Sunday Brunch as part of their Sunday Crunch with some of the exercises that instructors can do. And then I guess finally, which leads me nicely onto Jane's presentation, is some of the targeted place-based activation of the campaign. So these are 10 areas across the country, and unfortunately none of those reside in Sussex, but across the country is just to test, actually, if we put a bit of pump priming funding into some areas that had a really high prevalence of health conditions, and Somerset was one of those, and I'll let Jane talk to this in a bit more detail. Actually, can we generate some really rich learnings that can then be shared more widely around some of the ways that you can unblock the system, you can support individuals, and you can inspire and support them to be active. And that really concludes, and I appreciate it's a whirlwind tour, that concludes an overview, I guess, of some of the data, some of the challenges, some of the misconceptions, some of the programs that are in place. This isn't about having the answers. Let's be really, really clear. This is not about us coming with the answers, having the answers necessarily. This is an evolving area of work that we can only achieve and support this audience if we work collectively. And so I thought it'd just be useful to give you that snapshot, and happy to take some questions at the end. But without further ado, I'll stop sharing my screen and I'll pass you over to Jane to take you through what they're doing in Somerset.
That's brilliant, Tom. Thank you.
Jane, sorry, just before you go ahead, Tom, we didn't get the sound for your video, just so you're aware, for the case study, which looked great. I didn't want to stop it because
that's all right.
That were still able to read it, but we will circulate it after this for everybody that didn't get the sound, and there'll be an opportunity to watch that again.
Yeah, just to be, so it'll be embedded into the slide. So when we send the slide deck round, it'll be in there. But we could also send the link. If people go to the supporters hub, they can access that video of Tommy amongst all of the others. And I think it's a really emotive set of case studies, and I would encourage everyone to go and have a look. So apologies about that.
Sorry, Jane, go ahead.
Perfect. So is my screen sharing happily? Okay, I should be sharing now. So hi everyone, my name's Jane Knowles. I Chief Exec at Sussex Activity and Sports Partnership, so sister project to Active Partnership to Active Sussex. Kind of delighted to be here. I went to uni very many years ago now at Brighton, and still have aunts and uncles living in the area at Ringmer and East Hoathly. So it's kind of nice to be even virtually in Sussex. So, and I'm going to follow on from Tom. Here we go. So I just want to give you a real quick snapshot of Somerset about where we are. You can see that the map shows that we're a relatively elderly county. We have a very rural population, with about 48% of our population living in the rural areas rather than the urban. And as you'd expect with an elderly population, we actually have a huge number of long-term conditions, much more than the national average. And hence we, well, I think it was a lucky thing, but perhaps not if you're one of those people with long-term conditions. We became an activation area in the West Somerset area for We Are Undefeatable, which Tom has talked about. So where did we start, and what was the backdrop really before we started? I'm going to say that our relationship with public health was fantastic, but our relationship with the CCG was not as good as we would choose. It was very sporadic, it was a bit transactional, and I would say was not strategic. But we did have a lot going on at that time. So we had lots of primary care networks starting to come together. Some PCNs were really developed. So the one in West Somerset, which is our activation area, very developed. And sometimes that can be a bonus or not, actually, because some things are then set and it's much harder to change them. But we really saw this as an opportunity to start having, I suppose, richer conversations with a whole lot of providers in the system, and those that actually sat outside it too. So our healthy living pharmacies became quite a key network. We had a very excitable regional coordinator who was lovely to work with, and that was great. And we'd seen the social prescribing investment, which is all coming through the CCGs. Somerset's always been quite good at social prescribing. We'd already invested, but what we did have was incredibly unequal investment across our county. So while we had huge, actually really large investment in 3 of our local authorities, 2 of our local authorities, including West Somerset, had practically nothing, and so very inequitable, and a chance for us to make a bit of a difference. And then obviously we had neighbourhoods. So there was lots going on, and actually there was a real focus on structure and not people. And every conversation that we started to have was very much about structure. And I really wanted to make it about people, because actually we needed to be patient people centred. So I wanted to give you a little bit of the major thing that we brought to the table, I think, was a bit, as Tom was saying, those real life stories, and the fact that actually people should be able to make some choices and be empowered around their health, which is all that stuff around risk that Tom mentioned. And I just want to say, it's a really short film, and I hope that this works. So Ross, if the sound doesn't work again, then just put stuff in the chat box and I'll stop. These are our undefeatable ambassadors.
My health problems has been
osteoarthritis,
leukemia,
fibromyalgia, 3 different cancers.
I could only walk a few yards for weeks.
I just sort of wasn't really doing anything.
they're just simply getting worse and worse.
That's why I started coming to the gym.
physical activities help me enormously.
I find walking easier now.
It's great fun and we get to know each other and we make friends.
I'm going to have a go at doing something.
Any exercise I've learnt makes you feel better afterwards.
I can keep myself fit, I can keep myself relatively healthy and keep myself focused on something positive.
Me enjoying exercise is unheard of, but I do.
I owe it to them to make sure I don't just survive, I live.
So those were our some of our ambassadors, and we had 12 ambassadors. I have to say, we had lots of people knocking at the door to be an ambassador, and that speaks of that 45% or so that Tom was talking about, which actually people with long-term conditions that really wanted to say, actually, we don't love physical activity, but it's made such a difference to our lives. And we really brought that to the table. And do not underestimate actually that voice that you can bring to organisations that are very large, that sometimes find that really difficult to connect with the individuals that actually they are trying to work with. And so the activation of We Are Undefeatable and what drives us. So the word collaborative, I think, oh, sorry, I'm just not on a slideshow, am I? The word collaborative is overused all the time. And we have worked so hard at changing that culture. And the thing that I really want to say is that that third point about working energetically together and not competing has been like the major piece of why it has worked. So, and when I talk about sort of that, I'm talking about actually understanding that just because I think something does not make it right or fit, and there's the collaborative bit. I have worked energetically alongside my team to actually do a whole lot of things that sort of quite operational sometimes, but it's really helped people understand what it is that we can bring. And it is getting rid of that subtle competition, because in reality, I don't mind who provides the physical activity. I don't mind who provides the message. I don't even mind, luckily for me, who gets the kudos for that. I just need it to happen, because we know from our ambassadors what a difference that it makes to them. And we have really lived those values. And we've really, Tom talked about the We Are Undefeatable being a collection of charities, and we have mirrored that in Somerset with a collection of 12 of us, Somerset group of charities. And it started a lot around We Are Undefeatable, among other things, but actually has moved into huge numbers of other areas of work, some of it not physical activity, but has made us work together as a voluntary sector. And made it much easier for the statutory sector to commit to commission across the voluntary sector, which is key. And then COVID came along. So we've just put our We Are Undefeatable post holder, if you like.
Jane, sorry, can I just interrupt you for a moment?
Yes.
Some of the text is coming out a bit blurry. Is there can you stop sharing the screen and then go in again with the video box unchecked? Just because I think that's what's making it blurry.
Okay.
That makes sense.
Problem. Oh. Hold on. Sorry. That might do it. Okay. Is that better? Does that work better, Ross?
That looks better. It was just a few people were struggling to read some of the text. So.
Oh, sorry. Okay. So along comes our post holder was appointed on the 3rd of March. 2.5 weeks later, we went into lockdown, and the poor bugger had to work from home, having only had a very basic induction. And we were like, well, what can we do? We have a whole load of older people with long-term conditions who are not particularly well digitally connected. And so we did something really simple and really operational. We put together resistance band backs, and we put together about 200. And we ended up, as you can see, distributing right across our county through radio and whatever. And the reason that I put this in is because everybody goes, God, isn't that operational? Do not underestimate that, because this is the place where everybody went, we want physical activity, and look at them go. We want a piece of that. And actually, we were invited to huge numbers of strategic groups off the back of that. I'm going to share, this is, and off the back of that, James Rimmer, who is our CEO of our Somerset CCG, we found out that he was shielding. And what a gift. He absolutely said, oh, well, I would love to be one of your ambassadors. This is a slightly longer video, so I'm going to play it, but I might stop it in the middle if it plays.
I'm a chronic asthmatic is my underlying condition. Just, I live with it well. I think I'm fit and active. And in a sense was sort of surprised to find myself shielded. If I get an infection, like chest infection, I sound like Darth Vader. So it was also, kind of fairly emotional to suddenly find out that you're in that shielded category, clinically extremely vulnerable. And of course, one inevitably feels vulnerable as well to go with that. I love getting out and about. I mean, I always describe myself as I work hard and I play hard. I have a pretty full-on job, but actually I balance that by getting out and about. I'm a very keen cyclist. Saturday morning is kind of my downtime. I get out on the bike and I'll ride 100 kilometres. Physical activity, it means that I can really help keep my life in balance. For me, it's something I can do about it. I'm on a mix of drugs like most people or many people with long-term conditions are. But for me then, it's about balancing that with what can I do about it as well. And kind of working my lungs and getting the best out of them I can is important. I love being out and about. The great thing about cycling for me is you're out and about in the countryside. And I worked out a figure of 8 course around the garden, just walk around that and just kind of walk or even kind of run around the garden just to try and give myself a bit of exercise. Being released from lockdown was a really interesting, from an exercise point of view, it was really interesting because was it safe? How did I feel about it? How was I going to feel? And lots of people were asking me how I was going to feel, and I said, I don't know, I don't know what to expect. There's a real understanding of what it's like to both, there's both the physical issue of being extremely vulnerable, extremely clinical vulnerable, but also the kind of the mental challenges around that as well, and the kind of emotional side that brings. The shielded group of people, I think, have had a different experience of lockdown to many others. I certainly don't let my condition drive, stop what I'm doing. Now, clearly, there are times when it's, when it does impact and I can't do everything I want. We all live, many of us live with underlying conditions, whatever they may be. And actually, in the job I do, I think it probably helps to understand we're both patients and, and in my role currently as a commissioner, we both provide services and set out what services are needed for the public, but also recipients. And that kind of patient experience, that user experience that I have should impact on my role. And I'm just really keen that when we commission services, when we deliver services, we do it in a way that meets people's whole life needs, rather than just fixes their particular the particular issue that they're living with that day.
So you can see that we ended up with a really good advocate in terms of our commissioner and our CEO. Sorry, I'm just getting back to this. So from there, we ended up being invited onto the long-term health conditions cell, which was a sort of emergency cell response. And I suppose we were on a call with Tom, which Tom facilitated, and we listened to what Sheffield had been doing, which was sending out lots of active at home packs. So we'd already done bits, and then we had and ended up having a rather useful conversation about what do we do for our shielded list, and actually the whole CCG was really engaged with that because their chief exec was shielding, and so they were very, very engaged with that, and that personal relationship, while you wouldn't want it to be that way, actually made such a difference. And we ended up, the NHS actually spent, I think we've just had the invoices in there, so they spent around £17,000 actually getting the Active at Home packs. And we said, oh, please, could we do more than that right now? Could we send out a physical activity survey? Which I think in their minds was just me asking how active people were. But actually, we've ended up with some really lovely data. And you can see what went out in the pack from the slide. We did the We Are Undefeatable for those that were under 60, and the Active at Home booklet, which I think Sheffield had developed for the over 60s, as well as the survey, and very importantly, a prepaid envelope. So the survey covers not just the basic what do you do, but a whole load of things, and I think you can read that from the slide. So we were really interested in how active people were, but we were really interested in all of that around the household digital access, their knowledge and confidence to be active, and it went to about 27,500 people. So analysing the data was fun. So we arrived into work after it going out right at the end of July, right at the end of shielding, and we came in, and I can't tell you, our whole of our office was completely covered in envelopes, and there was so many. So not only did people pull their surveys back in, but actually so many lovely stories as well. So we've had, it went out to 27,500 people. We've had just under 3,000 pieces of data back, so individual surveys come back, with around half of those happy for us to follow up if we want. And huge amount of qualitative data. So we were lucky it was perhaps August, because we managed to get a huge number of students in who put all the data in, and it's all in now. And now we're in the point of putting the insight pack together. So I'm going to give you some basic info now, because the gold, in reality, the gold of this is about the interrelationships between the variables. So does living alone and having digital access, what does that do for your physical activity, you know, versus living alone and not? Does it make a difference? Does living in certain places make a difference? You know, and so we were really, the gold is coming, but it was going to take a little time for us. We hope to have that ready by the end of October. So this is the sort of stuff that we got, and you can see that the demographics, and everybody's very excited about the demographics because we have the older cohort. So most of our surveys, and this sample was not when they are all in. So this is, most of them were 70 to 79. There are very, very few surveys, and certainly none in Somerset, that actually have given us this richness of data for this age range. And the thing that we were really interested in was actually digital access and digital confidence. And you can see that it has surprised the whole of our CCG how much digital access that group has. And now that we have all the data in, that really hasn't changed. So nearly 80% of our population that is, and it's a good robust survey, have digital access. However, what they don't have is the confidence to use it in the way that we would choose. And I'm really interested, I'll talk about some of the future stuff and how that's being used. None of this will be a surprise to you. They are classic barriers and motivations. But the interest, like I said, is in looking at relationships between things, like I've talked about living alone and your digital confidence and that effect on activity, your ability to be active and living alone, all of those things which are really key as we talk about long-term conditions and older people, and really affect their mental well-being as well. And this has started to have real resonance right across CCG, and they are not using it just for physical activity, which for those of you in my situation means that actually we're able to access all sorts of strategic groups, relationships, and really increase the richness of our knowledge and our awareness of what's going on. So you'll have a look at the purple graph with the days those people were active, those shielded lists are active. They said self-reported. It's a single item question, so it's the same question that Sport England used for their COVID survey. And you know, lots of people said they were 7 days a week, but when you drill down into some of that qualitative data, most of it was housework and gardening. So we know that it is at a low level and not probably enough for their health. The graphic on the right really shows sort of that people felt that they had an opportunity to be active, but actually lacked that confidence. And there's a thing that Tom and the We Are Undefeatable campaign have started to try and address. And it's really helpful to have this to sit backing it up. And I know it's Somerset data, and actually just right now we are just trawling through it. But I have made it very clear that this data is, you know, it isn't just mine to hold on to. I'm a great advocate for physical activity, and I really want to share as much of this. So it's a delight to share it in Sussex. And once we have analysed it, I just want everybody to have a piece and be able to make the case for physical activity. But you can see that there's quite an even split around whether people find physical activity enjoyable and satisfying. And really interestingly, our ambassadors all said, I didn't really enjoy it, but actually it's made such a difference to my life. And now I've made a few friends and connections. Actually, yeah, it's part of my daily routine. And so getting those messages right is really important too. And this was a bit of a key message that came out. It's like, please do not box me into I'm 70. Actually, I'm Fred, I'm Chrissy, I'm whatever. And I have a life story behind me. So please don't put me in this homogenous group. Treat me like actually I'm worthwhile. And that came from some of the, I have to say, we got an awful lot of letters that came, lonely people, but actually people who still wanted to be treated like they were individuals and not a homogenous group. And the insight pack that we've got, I'll be really happy to share with Ross, and those people that want it can have it. I'll share the link so you can have it if you want it. We are really keen to couch our interventions around this with real resonance for those that are over 70, because actually they're saying that they like the number of phone calls we got, because we left a special number for some people who perhaps would find it difficult to write or wanted to get in contact. Huge number of phone calls as well. This is a group who want to engage, but they want to engage on their own terms and in their own way. And it's very easy, you know, when I was 20 odd, I remember thinking 70 was a long way off, but now I'm 53, I'm thinking it's not that far off, and actually being 70 would be actually not that far away from me, and I don't want to be treated like an old person. So maybe it's helpful I've got that resonance for me too. So what are we doing from our survey? So apart from the insight pack, which is in draft form now, and we have a run through with CCG with all the data, working out where the interrelationships are. We have started a Love to Pedal scheme, which I just want to thank Wigan for that, Inspiring Healthy Lifestyles in Wigan for that, who've been fabulous at sharing some of this stuff. And this is going into care homes to cope with some of the deconditioning that we've seen, and falls prevention. But actually, the shielded data stuff has said that lots of people would really like this as an intervention, like social prescribing, into their individual homes. And the bells and whistles for those people with dementia, we've put local rides together. We've trotted around with the GoPro and put local rides together so that people can see some of our amazing landmarks. Cheddar Gorge, Glastonbury Tor might be the two that most people would recognise. Really interestingly, though, the Digital Access Somerset Foundation Trust made a bid for £250,000 to actually buy masses and masses of hardware. Our survey has said that they don't need to buy that much, and they are not going to buy as much. They are going instead to use that to train people, to help older people gain more confidence in their digital access. So there's one part that has influenced really nothing to do with me particularly, but it has given me the conversation and strategic buy-in at a high level. We do lots of training, and Tom mentioned how important the workforce was, and it sure is. Some of those messages that the expert talking to, there are moments when those teachable moments are important, but there's also incredibly important for those messages to be drip fed continually wherever they go. And then obviously the COVID-19. So actually they were so keen on some of the data that came back, the qualitative data that came back. We have worked with our CVS and they have jointly funded some champions because they really want to see how we can embed physical activity as a response to COVID through that community feel. And that's, we're just recruiting to that now. So my last couple of slides, what do I feel is changing? So I think that, you know, we blabber on about system change, and it is my thing is, and there are loads of systems, there are thousands of systems that we might want to change. So this is what I'm feeling about some of the systems that I touch and see and for physical activity. So those attitudes are really changing. CCG is starting, so they've always talked about prevention, don't get me wrong, they've always talked about it. The budget has never followed. I am starting to see differences in the conversations at strategic level. Our long-term health condition cell is now being led by a consultant with CCG. It's got high level buy-in with associate directors. And actually I sit there as part of the VCSE sector, and physical activity and exercise is talked about every week on those calls as a key thing. So we're starting to see that happening, and money is starting to be unlocked into the prevention agenda. So funding, I have to say the relationship between public health and CCG was awful, and it's just starting to be building bridges through this. And that actually is through We Are Undefeatable. I'm going to say it's absolutely through We Are Undefeatable, because the resource that came with that has allowed us to do things to show people what a difference it makes, and that is hugely important. And they've also understood that relationships are key. So housing associations are starting to play a much stronger part and much more positive as they understand what they can do and what their role is and the key people that they house, if you like, and what their reach will be. And there's those positive ripples, which are some of my favourite things. And Tom mentioned, active practices. So just before COVID, it just appeared. I'd done quite a lot of work, wasn't quite sure where it had gone, and suddenly we find that active practices had been embedded in every GP contract. And that's now having resonance around the obesity agenda, because they're saying, so if our staff are more active and more whatever through the active practices, then actually they have better conversations. So strategic is great, but actually it is operationally also that is really important, because it's if we're going to be people-centred, which is where I started, then we really need to understand how that works. And we are now seeing our PCN in our most deprived area of Somerset employing 3 physical activity specialists from their social prescribing budget. And that is not a 1-year post or a 2-year post. It is money that is there for a very long time. They said forever, but there's never a forever, is there? But and that is really important for us, because that area is exactly where our least active people reside. We've been contacted by all the social prescribing teams now, all the health and wellbeing services. They're coming to us to say, I'm not having to go and sell our service quite so much. They are coming to us and saying, we want to be part of you, we want to connect, we want to gain the benefits that physical activity bring. We're starting to understand that because everybody's telling me about it. And the training needs are starting to come. So training is we all love to get money for training, but actually finding people to go and do it positively sometimes can be tricky. But actually we're getting people putting their hands up. So what's next? And have we finished? Hell no, we have so much to do. Doors are opening and windows of opportunity. And we are working like fury to get it done. And we are really energised by the amount of partners, both within the statutory sector, but also within the BCSE sector, that want to get involved, that are really actually seriously keen on physical activity. And that is because we have energised it and we have hung it off We Are Undefeatable, which everybody can understand. It feels like it has a national flavour for them and has been an amazing opportunity for us. So, and my last slide, so a really big thank you to all our partners. So I get to front this, and it's very weird doing it virtually, but in reality, none of this work happens without anybody else. And I talked about being collaborative, but also not being competitive. So the work we've done with COVID volunteers, Spark is our VCSE volunteer, VCS, that's the word I wanted. And actually, we sat there on the phone yesterday going, oh, I don't know I need that many, you have it. And she's going, no, I think it'd be better placed with you. We have become trusting, transparent, because we are person-centred. Who is the best place to, who is the best organisation to have that? Who will have the best management structures to help somebody achieve the outcomes that we're all looking for? So, and also that diversification across the piece gives us much richer knowledge and conversations, and so partnership work, we talk about it like it happens all the time, and it does, but my plea to you is to try and make it less transactional and more transparent, and to try and get rid of some of those subtle competitions that we have around that. So we would never wish COVID-19 on our country, absolutely not. But there were real opportunities as a teachable moment for physical activity, as a reduction of risk to those people who contract COVID. And also, so please take that opportunity to reach out to some of your partners in your communities and elsewhere to actually make a difference to some of the people that you work with. That's me done. Thank you. I'll stop sharing.
Brilliant. Thank you so much, Jane, and to Tom as well. There's some really, really interesting stuff there. Plenty for us all to think about, and not just think about, but to act on as well. So some really, really good stuff. I think there's been some good chat going on as well. I think the main issue has been around coaches and workforce and whether these need to be, I don't know if you had an opportunity to look in the chat box, Tom, but the specialised nature of the coaches, volunteers, workforce, working with people with long-term conditions. Some people saying that, yeah, we need a more specialised workforce, others saying that it's not a one-size-fits-all. Yeah, just your thoughts on that initially.
Yeah, thanks, Ross. Yeah, it's a really, really important area. And so thanks to those for raising the questions. I think one of the challenges when you're giving a presentation, you have to fly over a lot of the slides, is that you can't go into the depth. I think just to reassure a couple of colleagues who I think it was sort of suggesting that we do need that specialist, and we shouldn't lose that. I couldn't agree more. I think for a number of individuals with health conditions, receiving support from a workforce that is very knowledgeable and specialist is absolutely integral. The challenge is they don't account for the whole workforce. And so it's how do you bring the level of understanding and confidence up amongst the breadth of the workforce to be able to support someone's needs. I was writing a few things down and I thought this is a really interesting area for discussion. And this is to be absolutely clear, this is not us, and I said reinforce, this is not us coming with the answers, this is us stimulating the debate to get to the core of the problem and then understand what some of the solutions might be collectively. So I guess there's a few things that come up. We work really closely with SIMSPA and UK Coaching as our expert workforce colleagues. And what SIMSPA have done recently through the development of the new standards, one of their standards is about supporting and working with people with long-term health conditions, and we were part of developing that standard. And that's been really clear that we absolutely need a workforce that has that specialism. I think the challenge is, and I guess the open question is, the workforce is huge. The frontline physical active workforce, from being a run leader to delivering walking football, to being a sports club coach, all the way to being a PT in a sort of a fitness environment, is we have a workforce that has the skills across everyone to be able to support the needs of that individual. One of the things that really resonated with me in a couple of the comments were, and I think at its core is, what we want every coach to be able to do, and many of them do and can, is actually how do you understand, what is the process of understanding someone's needs? Where can you go for more information if you need it? And how do you adapt to your session to be able to support them to have a great experience of being active? So that inclusivity and accessibility is at its heart. One of the other comments was sort of suggesting that being a specialist doesn't matter. That isn't what we're saying at all. I think we've created, we didn't have time to go into it, but we've created a bit of a workforce levels that we want to encourage the workforce to work through. So at its base, we want everyone to provide a person-centered approach, to be able to have the skills to understand someone's needs, to be able to adapt their session accordingly. I guess the next level up is, where can you go for more information around long-term conditions if you need it, to be able to apply and provide that individual with a bit more support and have a great conversation with them about what more you can do as a coach. But of course, we want to encourage coaches that there is a pathway, and this is part of what the learning and development pathway is. There is a pathway to follow that will allow them to develop some real expertise and specialism around long-term conditions in particular, should they wish to do that. But not every coach is able or wants to get to that level of understanding and specialism. So I guess, to someone's point, there is no one size fits all. We want a workforce, depending on what that individual's needs, we need to be better at understanding holistically what an individual's needs are. So not just their physical and mental health, but where their motivations are, what their goals are, and how to support them to get there, and understand the right pathway for them. And so, to the point around some of the work around cancer patients, some fantastic work going on. If that is what's right for the patient, we want to support, for that individual, we want to support them into that. But for that individual that just wants to go to a walking football session and lives with a long-term health condition, what's the expectations of the workforce? So it's an open question. And that is that's the role, the sort of the path we want to go down, to ask those hard questions and go, actually, there's basis around what the individual's needs and motivations are, and how do we have a workforce that can support that? And I guess that's what's at the crux of it. But there really wasn't enough time through the slides to go into that level of detail, but I completely understand where those comments are coming from.
And I just want to say, we have the long-term condition cell in Somerset, is chaired by a cardiac consultant, and his take is, well, if 40% of people with long-term conditions are not active enough for their health, I can't manage all of that with an intervention. So actually, we need to do, and taking Tom's point, there's a level of intervention where you might want very qualified, but he's like, actually, we really need to get those messages out there, because people need to do more. And actually, his thing is, they are the experts on their own body. And he plays with people's hearts. So, well, I hope he doesn't play with them. But,
Thank you. Did anybody have any further comment on that, or want to come back on Jane and Tom just to clarify any of that? No? Okay.
Just to add, Ross, I think it sounds to me like there's some real expertise in this group and experiences. And I think through the co-production of the learning and development pathway that we're talking about, from your on-the-ground community coach right up to a very specialist level of knowledge and understanding, I think we really want to encourage people to feed into that. So I think what we'll do is we'll share the opportunity, and when that comes along, to how people can feed into that process to really build a pathway that works for everyone. So I just thought I'd just get that in there.
Fantastic, thank you, Tom. Another point I can see raised here by Ricky is amazing information and lots of stats, but individuals with different circumstances have polar opposite experiences of COVID. He's made the point of newly injured people or people who may have just acquired a long-term condition won't necessarily have the resilience built up over time by others that have been living with long-term conditions. Have you seen anything from a Sport England perspective or Jane in Somerset where there is a difference between those who have newly acquired long-term conditions engaging in physical activity?
We haven't done anything specific around that. It wasn't actually something that we asked on the survey about how long they'd had a condition, which might have been an interesting question. But no, I don't have. I mean, I understand. I understand that would be really hard, but I don't have any particular information on that.
Yeah, I'm just trying to think, Ross. There might be trying to unpick. So within, and I guess it's a really good resource within the We're Undefeatable Supporters Hub. We've got a whole COVID-19 insight pack, and this is from all of. I mean, I've just touched on tip of the iceberg, some of the data and the stats and the insight, a real richness of insight through what we're hearing from people with lived experience, is that there is that range and there is no blanket approach to it. So I'm trying to rack my brain to something to help with that, but I think there's lots of information within the insight pack that probably talks to that particular point in how the differences of how people are being affected, and not just with a health condition, but everyone generally. So I think it's and I guess that's the crux of the message of We're Undefeatable. It's how being active in a way that works for you, and that is around whatever space you have, whatever your level of ability or capability or things of motivation are. It's around what can you do rather than what can't you do. So that's that very positive framing of it. So I think there's a lot more to draw on in the insight pack that I wish I had at the tip of my tongue, but it's there for everyone to read through.
I'm going to thank Ricky because it's not something I particularly thought about, so I've written it down.
Thank you. Stuart, I know there was a point and a question raised by yourself. I'm struggling to find it. If you're there, Stuart, would you be able to come in and ask that around social prescribing?
Sorry, thank you. Yes. Yeah, I was just wondering in terms of the social prescribing, but also around the primary care, physical activity champions in primary care. Gemma's partly answered this actually, or covered it. I was just wondering what discussions were happening at primary care network level. We've now got the PCNs in place locally, and I just wondered in terms of developing primary care staff, were those discussions happening at a sort of a PCN level rather than maybe at a individual practice level? Because the PCNs are probably the place to be working at and looking to influence now.
Do you want me to take that? At a local level, yes, definitely working through the PCNs. We have really good relationships with probably about half of our clinical directors. We're still working on the other half. We have an unlucky 13 of PCNs in Somerset. Yeah, I'd agree with you, Stuart, that is a great way to go, but they're still in a bit of flux at the moment, particularly as all the social prescribing money's coming in, and they are trying to work out what they're going to do with it, and how they. So it's an opportunity, but it is, and things are moving incredibly fast for them. So now's the time to jump.
Thank you.
Thanks, Stuart. I can see as well that a couple of people have asked about training for health professionals and whether this is available to other organisations locally. And Nick and Gemma from Active Sussex have been communicating in the chat as well. So that's great. That's absolutely what this is all about. Has anybody else got any other questions or points they would like to raise that I've either missed or that hasn't gone into the chat box yet? No? Oh, no, I don't think so. There was one question from myself, Tom, going back to the consensus statement on risk, and I guess this is around the workforce stuff as well. In terms of what we've been looking at over the last 6 months and then potentially going forward as well with online delivery, is there more of a risk around what's being done virtually? So if we took GPs, for example, is there more of a risk from their point of view that actually there's not that face-to-face delivery and signposting or referring somebody into something that's delivered online where the same level of assessment may or may not be made? Is that sort of altered anything around risk?
It's a really good question. I think there's two things there. One is that we haven't heard that explicitly from healthcare professionals. So that hasn't been something that's come up as a particular concern. And I guess that's because it's the reality of the situation we're in. I guess it's because not being able to conduct face-to-face group-based activity or one-to-one activity face-to-face, we have to go online. And I think we're, as a sector, I think we're going through that transition of understanding what it means to be able to deliver that in a safe, inclusive, engaging way. And I think we're all learning together. So I mean, there's loads of resources for those, and I don't know if this is echoed on the Active Sussex website, but there's lots of resources on the Sport England website about how to deliver sessions online safely, and some of the principles and that some of the areas to consider when doing that. I think one of the things to come out, my personal view, is that I think one of the good things, if this can be said around COVID, is around how we are starting to broaden how we think about supporting an individual to be active. So I think going forwards, I think a lot of organisations are already starting to say they've had a lot of really positive feedback around delivering online, and actually that works for that particular individual as part of their daily or weekly thing. And actually, if this was something ongoing, they'd be more likely to continue to do that. And so having the option to do it online versus coming to access face-to-face things, you start to give a sense of, you can be active with our club or with our session, but through different means. And to the individual, in terms of that motivation, that's been a really positive thing. So I think we're still going through a learning process around what it means to deliver online well at scale, but not particularly hearing any concerns about it yet.
Right, thank you.
It's sort of relevant and not relevant, but our gym that operates in the West Somerset area, our activation area, has seen a big drop off in our what you'd call the core market. So, but actually has kept all its GP referrals. So that GP referral, something like 78% of them have come back under the COVID secure face-to-face stuff. And actually it's the core market that's dropped because they've all gone online or found other things. And I wonder whether that's, we'll explore that, but a key message for some of our leisure facilities to really help them galvanise around this agenda as well, because it's not always the easiest agenda, and but we need everybody to help.
Right. Thank you,
Ross.
Jane.
Ross, can I just come back in quickly, because I think Jacqueline's just raised a good point around some of the frail elderly and some of the risks of falls. And actually, something that we probably wasn't mentioned, and an impact of COVID is there's a real pandemic around deconditioning, and this is around not just the frail elderly. This is around people that come away from their daily routines, but it's particularly prevalent in older adults, whereby actually we're seeing such a reluctance to venture outside, be active to any degree that would really benefit their health. They're actually starting to decondition and actually becoming, and that with it brings a real risk of further, adverse effect to their health going forwards. So actually, come the end of a pandemic, when you haven't been active for a long time, and Public Health England have talked about this a lot, is there's not just going to be a lack of motivation to get active, there's going to be a lack of feelings of capability to get active because of that deconditioning. And so actually it's even more important to be able to have a diverse offer to different types of audiences, to particularly around strength and balance type activities at home. So it's not just around moderate intensity, it's around the strength and balance element as well. So I thought it was a really important point to raise.
Yeah, and I would say as well, through a lot of the feedback we've had and conversations we've had with local partners, they've done an incredible job in thinking differently about how they can deliver that, and being flexible at a time when it obviously wasn't easy for them to change how they deliver. So it's absolutely something we're keen to support all our partners with. I can't see any other questions that have come into the chat. So if nobody else has got anything else that they would like to add or ask Jane and Tom before they go, I'll just take the opportunity again to thank both Jane and Tom for their time and all their effort that went into their presentations and for linking in virtually today. I found it extremely interesting. I'm sure a lot of you have got a lot to think about now. But yeah, thank you all for your time as well and for engaging in the conversation. And as I say, from what I can see in the chat box, there's a real opportunity there for partners to engage with some of the training that's happening as well. So if you have been part of this session and the other sessions today, you're probably dying to get away for some lunch. So we're going to let you go now and then hopefully see some of you later on for our next session, which is encouraging diversity and inequalities. Brilliant. Thank you all.